Unit 11, test questions 2. 68. A client diagnosed with tuberculosis is distressed over the loss of physical stamina and fatigue. The nurse plans to teach the client that 1. This is a short-lived problem which should be gone within 1 week of drug therapy. True. This is an unexpected finding with tuberculosis, but it should resolve within a month or so. 3. This is expected and the client should increase activity gradually as tolerated. 4. This is expected and will last for at least a year. The correct answer is 3. This is expected and the client should increase activity gradually as tolerated. 69. A client with post-operative incisional pain complains to the nurse about completing respiratory exercise. The client is willing to do the deep breathing exercise but states that it hurts to be cough. The nurse provides gentle encouragement, the appropriate pain management to the client, knowing that coughing is needed to 1. Expel mucus from the airways. 2. Dilate the terminal bronchioles. 3. Provide for increased oxygen tension the alveoli. 4. Exercise the muscles of respiration. 70. A nurse who is orienting another nurse to the emergency room instructs the orient to assess for one side chest movement on the right while a nurse being incubated by the physician. The nurse instruction based on the understanding that the endotracheal tube could enter. 1. Right mainstem bronchus. 2. Left mainstem bronchus. 3. Esophagus. 4. Stomach. The correct answer is 1. Right mainstem bronchus. 71. A clinic nurse administers Montag skin test to a client. The nurse tells the client to return to the clinic for reading the results in 1. 24 to 36 hours. 2. 24 to 48 hours. 3. 36 to 48 hours. 4. 48 to 72 hours. The correct answer is 4. 48 to 72 hours. 72. The nurse is assessing the client the typical clinic manifestations of tuberculosis. The nurse would expect the client to report having symptoms of fatigue, the cough that have been present for 1 to 2 days, 2. Almost a week, 3. 1 to 2 weeks, 4. Several weeks to months. The correct answer is 4. Several weeks to months. 73. A client with chronic obstructive pulmonary disease who is beginning oxygen therapy asks the nurse why the flow rate cannot be increased to more 2 liters per minute. The nurse responds that this would be harmful because it could 1. Increase the risk of pneumonia from the rear air passage. 2. Be drying the nasal passage. 3. Decrease the client's oxygen-based respiratory drive. 4. Decrease the client carbon dioxide-based respiratory drive. The correct answer is 3. Decrease the client's oxygen-based respiratory drive. 74. The nurse has instructed to a client using incentive spirometer to sustain the inhaled breath for 3 sounds. When the client asks the nurse about the rationale for this action, the nurse incorporates the understanding that the primary benefits is to 1. Dilate the major bronchi. 2. Constrict the alveoli. 3. Enhance ciliary action, the tracheobronchial tree. 4. Promote adequate gas exchange. The correct answer is 4. Promote adequate gas exchange.